Welcome back, everyone. Vitality Check Podcast.
Thank you.
Good to be here. Dr.
Good
Sean Landry to my right or left, if you're looking.
Kev's on his
Kev was sitting on the
booster chair.
yellow pages.
Oh, yeah, this chair is like
The
a
booster.
throne.
Really high. It is like a throne.
Yeah.
Yeah.
You guys are gonna have back pain. And to my
For
left/right, depending on where. Not even the screen is like.
maybe it flips.
Jason Turnbull
Hi, everybody.
and today's host, Kevin Longpre. But we're changing it up. We're just changing it up, trying to keep everyone on their toes. We don't know who's going to host, who's not, right?
That's it.
It's good for the nervous system. People don't get complacent.
Trains resilience.
Exactly.
Got
You
a
get,
big
you get comfortable in one thing, boom, we change it up.
Kevin changes it up.
Quick, or maybe. So what's new, guys?
Did you introduce me? I forget.
I did.
Yeah.
I even said doctor.
I wasn't listening.
Didn't even laugh.
Mm.
Wasn't listening.
Nice. Sounds familiar.
Still laughing about your boosters. Oh man.
Oh, nice.
How's everyone's weekends?
Oh, it was amazing.
Yeah.
Yeah, really, really good.
You're
Cold.
Cold.
Very cold.
Very cold.
Yeah, it is frigid out there.
Taxi.
But
Did you taxi a
There was
bit?
a lot of taxiing.
Yeah.
Yeah, a lot of taxiing, but it's very good. Got outside too.
I didn't get outside as much. It was pretty cold.
Yeah.
I try to be indoors more. I did taxi though, like usual, like you guys, like we all do, which is fine. Um, yeah, yeah, pretty quiet.
And
Okay.
curfews were respected. Everything
Curfews were respected. I did, yeah. I did have to do a pickup with
honestly.
him and his buddy, which is totally fine.
Okay.
Yep, it wasn't late at all. Yeah.
Nice.
Yeah. I told you I tried to, because I know you've been preaching it for so long, Kev. I tried some breath work this weekend. I was by myself after some yoga. It was pretty
Nice.
good.
Nice.
So that was,
And did you pass out?
you didn't, but I can see how people would. And hold your breath for a minute and a half. I'm like, excuse me?
Did you
Hold
do
your
you
exhalation?
did the
Wim Hof?
Wim Hof stuff? Hyperventilation.
Similar.
Essentially similar. Yeah. I just went to YouTube and,
Yeah.
and just followed it. I think I told you, what was his name again? Breath with,
James Nestor? No.
no.
Breath with Steve.
Joe Biden?
It was like something like that. It was not Joe Biden, that I can assure you.
Breath with Steve.
Yeah, what was it?
Breathe with
No, I think it was Shane, maybe. Hold on,
Breathe with Shane.
I'll tell you in a second what I did.
Should we
Breathe
be
with Bob.
researching right now?
Don't we need a guy to do that for us? Hey,
Yeah, we need
or a person.
like a sidekick.
Sidekick, yeah.
Sandy. Breathe with Sandy.
You're way
You're
up.
so close.
This
Swimmy, Swami, Samsonite.
Yeah, that
Um,
guy right there.
awesome. Wow.
Yeah, it was amazing.
He looks like a good breather, that guy.
He can breathe. He can breathe.
Yeah.
So I had to,
Any
go
tears?
off into a different corner. So like, no kids or someone wanders in and say, "What are you doing?"
Yeah.
Yeah.
Any
Why are you
tears?
sweating?
Yeah. No tears.
No
Definitely
tears?
some tingling. A lot
Yeah.
of tingling. Yeah, a lot of facial tingling, neck.
Yeah.
Wow.
Yeah.
You weren't having a stroke?
No, I did.
Glad to
I
hear
did test for that. I had 9-1 already on the dial. I was ready for one more if I needed it. But no, it was good. It was fine. I was just, trying to get into Kev's world a little bit more. It's good.
Yeah. Any visions of Kev while you're reading?
I did. Yeah, it did ask at the end what you see. I saw Kevin in a red
Easy.
dress mostly.
We can't air. Are you serious?
Yes, we can.
No.
Here we go.
No, it was very good. I was
Awesome.
very relaxing. Yeah.
Yeah.
Once. How about you, Sean? I know you're just waiting for us to ask you. How'd it go, Sean?
I was
Free boy.
actually no, we had a good weekend. Actually, it was good. We were busy with lots of hockey rinks and
Nice.
had a couple extra kids at my house too at some point. It was fun. I made them shovel off the backyard. I have a rink in my backyard, so that was actually fun. And they played and
Gets in the work.
pros, but they actually the funniest thing was Aiden and one of their little friends. They were shoveling, but they find it's big, 20 by 40. And I come out there like, Dad, we need your help. They had piled the snow in the middle. I'm like, well, they pushed it all to the middle. I'm like, well, no, we're not. So I had to like launch it.
Nice.
Anyways, it was funny. But then they were outside. They came in because they were cold, and I made
Dope.
pizzas. And then
Nice.
they went outside. So an extra kid, my three boys, and they were outside probably for an hour and a half. They had balaclavas and everything on, And that's funny because Brody had a winter festival in Dorval. He had a game at the new outdoor game at the new covered rink, so he was already outside for like an hour earlier that day.
Nice.
Yeah, they slept very well, needless
Yeah,
to
no
say.
doubt.
But
Mhm.
yeah, mini gloves under their long underwear, mini gloves, balaclavas under their
Mhm.
helmets, and
Yeah, if
but it
you're
was
dressed up for it, it's not
yeah,
so
Yeah,
bad.
yeah.
but it was cute. But when they hit the wall, they hit the wall. They like came in, in my back there. They're trying to get in all at the same time, and I only have one chair set up to take their skates off. So, but they couldn't even do it because they were so cold.
Yeah, they're kind of
Um,
Yeah.
frozen.
And it was good. It was fun. We had a good weekend. It was yeah. Oh, it was
very
good.
nice.
Yeah.
Amazing.
Yeah.
So we were thinking of diving in today to a previous episode that we had on perception and reality versus reality, and it got us thinking on the importance of the belief of the patient with regards to them and their healing process, and obviously what you're doing with them. Uh,
Yeah. Your
so
belief as well. Yeah, but
uh,
yeah.
no, but a belief of what you're telling them, right?
Yes.
So. We thought we'd kind of dive into that because we have so many examples of this where of on both sides where you have people like I was telling you today, but I probably treated the easiest patient ever. And you've seen this guy for the second time, and even the first time, it's like he was just, when someone comes in and they're absolutely ready,
Oh yeah.
they kind of are conscious of a bunch of reasons why they're stuck and why they're having certain issues with things. And it's like this guy just at 100% dove in, and it was the exact time when he needed to do it, and it just unraveled on all levels, like the physical restrictions he was having to even his mindset and what happened after, like it was pretty wild.
Nice.
But then you often get the opposite, where you
Hmm.
have people coming in and they're 100% have the brakes on on moving uh, maybe possibly into why something's happening with them. Not to say everything is psychosomatic, but quite often, it's a reflection of the person, how they're living, how they're viewing things. That is why the body's reacting in a particular way, showing just signs and symptoms of that on a more regular basis to when the body has no more capacity to compensate. So this is where it becomes important on our part, and that's why we want to talk about it today, just to help people out too, going into getting anything done, having work done, is maybe start asking yourself, where am I, on this scale? Like, where do I really want to get see myself getting better? Am I convinced on like my mindset is like, oh, I've always had this. Maybe I can improve it a little bit, but I don't know if I can completely go away. Or, some people get stuck in these little corners too with diagnoses, right? Like,
Limiting beliefs.
so,
Yep. Yep.
you have this, so you're not going to be able to do that anymore. And then,
Hmm.
whereas, there are examples of people fighting through that and finding balance anyways. But so yeah, so floor is open, boys. Let's maybe start either with could be an example of someone you had, or just whatever you feel is coming to you about that topic. Because I know both of you are really good at you know conveying this to your patients. Like it's I think that's maybe somewhere we can start. Is how do you do that? Maybe in your office to make that person understand and feel better about the process and put them on the side where they can use that belief.
Yeah. Well, I think it starts with listening. First of all, you're listening as you're, especially if it's someone the first time you're meeting them, you're, trying to get to their level and like you'd said, kind of see what lens they're currently seeing the world through and how they're essentially living, like how they're living life. Yes, they're here to present and discuss with us usually a certain pain or ailment they're having, but then you're trying to look at that big picture. So oftentimes it's just recognizing and listening to where they're at. And like you'd said, sometimes people can be super ready and they're excited to be there. But as we do this for all these years, we get so many different people and how they walk into our offices, from people who are told to come because their partner thinks they would be like osteo
Mhm.
or chiro would be good for them, to people who just there's so many different ways to look at it. So I think for me and is identifying that early is making sure that they're open for change, open for healing.
Well, that point exactly is something we see often, right? The
Mm.
the classically the wife coming in
Yep.
and then forcing her husband to come and see them.
Yeah.
Or
Yeah. Yeah. Exactly.
encouraging.
Encouraging.
Well, yeah,
Yeah.
but in some sense, like pushing, for them
Yeah.
to do something
100%.
about it, them reluctantly coming in.
Yeah. And maybe or maybe not wanting to be there.
Right.
Of
Yeah.
course.
Exactly.
Well, early, I mean, early, many, many years ago, it started like that, right?
Yeah.
Especially when you're first getting started, you want to take as any new patient you can get when you're just building. So
Mhm.
I remember doing that often, saying, "Hey, of course I can see them," and then it just not having the right outcomes because of that fact that they didn't even want to be there in the first place. So now I think all of us would be very saying, in our own ways, we'll say, absolutely, I'd be happy to see them. But what is their outlook? Like, do they want to come? Like, first of all, before you even ask, like they have to want to be here because if they don't, and that's what we try to explain when we come in. You can tell people are saying like, "Oh, I've had this for this long, and I'm never going to get better." Like you're
Right.
looking for these
Yes.
triggers. I just know it's always going to be here, and it's funny because that can be someone who's had back pain for 10 or 20 years,
Mm.
and that can also be someone who's had shoulder pain for 8 days.
Yeah.
Mhm.
And like, I know, it's done. I've got a tendonitis, and
Yeah.
like, do you think this will ever go away? I'm like, yeah, yeah, I
Mm.
really do. But it's funny how you have to kind of, I think it all comes down to listening and then relaying that message. And I think you guys would agree to do that very early on in the process to set that stage for healing, for them to hear that, oh my gosh, a lot of them aren't aware they're even presenting like that, right? They have no idea that, that's
And
true.
that
I
they're
did say
part
that.
of the solution.
Exactly.
Right.
Yeah.
Exactly.
Yeah, I couldn't agree more, Jason. I think over the years working with people, we get to know the different types of patients that present to our office, and as you said, where, what's the state that they're in when they show up. Oftentimes now, the phase of practice we're in, we get a lot of referrals, right? So when we talk about the power of belief, there's already a bit of belief that we can help them because we have seen one of their friends or helped or their partner or whatnot. So
Yep.
we've established credibility in the sense that someone is out there saying, "Oh, you got to see
So
Sean or Jason or Kevin or Andrea," right? This is really, again, this is that it adds to the energetics of it all, right? If the patient already has uh, a belief that we can help them for said ailment or whatever, then yes, it's already starting the healing process, or this healing process has already begun. Because, I'm a big fan of a book I've read years ago when I first started in practice called Timeless Healing by Herbert Benson. And this was, he used to study the relaxation response. It's basically meditation, and why, or prayer, or the energy or the power of community, right? So he'd study all these, the placebo effect in a sense, and his research was fascinating. I mean, he actually said the placebo effect was in the 70 to 90%,
oh,
right? And there's a certain industry that down regulates or tries to downplay the placebo effect, so that they can, sell you something. But he has research actually, if you look, and he would study just why this was taking place. And again, and the biggest kind of takeaway was the ability to believe that the therapy you were getting. So he would even show some sham examples or sham therapies, and they would date back where people would go in for a surgery and would have great success on the surgery, said surgery. But then years later, a study would come out saying that the surgeries were ineffective. And a certain percentage of those patients would actually start to have the knee pain again, even though they had been fully active for years. It had, fully functional. Just coming back to the power of the mind and the lens, the perception. Now, this is, as Kevin said, this is a piece of the puzzle, right? Because, you know, the mind is works in relation to the physical world, and the toxic world we're living in, and so, the environment that you're placing yourself in. But I think it is definitely the missing link because, you have to have the belief that you will get better in order to get better, right? And that's where we as therapists
Yeah.
can really help through, Jay, as you said, through understanding where that patient's at, through education, um, depending on what their condition is and what their state is. So, yeah.
I I think too, it's evolving so much in our field, right? Too, into understanding like the grand scheme of like what gets someone into that predicament. Obviously, there's certain therapies that are more focused on mechanical aspects of things solely, which is fine because that will actually again think about what both of you are saying. The person is convinced that that type of therapy is exactly what they need.
Yeah.
There's a very good chance it's going to help them
Hmm.
Hmm.
because they're just in their mind, it's nuts
Yeah.
and bolts. We got to get this moving this way, and which is 100%
Yeah.
uh, correct. That's the thing is whatever you think it is, you're right.
Yeah.
Whether you think, oh, I'm never going to get better, you're right.
Hmm.
Whether you think, oh, yeah, this person and only this person is going to help me, there's a very good chance that's what it's going to be. Like, so that's what we're trying to convey here is like, okay, well, let's set the mind straight so that we can angle it in a way that it's going to be beneficial to the outcome you want,
Hmm.
right? So, one, that what does that entail? That entails one, looking what is your current viewpoint?
Hmm.
What's your belief system, like you were saying, right? So if it's the case that, oh yeah, it's true. When I do think about it, it's like, why did this happen to me? I'm never gonna get better. I'm probably always gonna have to do this to feel somewhat normal. I'm never gonna be able to play this again.
Hmm.
Uh, Whatever the context, right? And everyone's experienced discomfort and pain and stuff like that, where you're like, wow, it really does bring you down. So it's understandable to get down into those viewpoints of things and realize like, oh, maybe I did try something and it didn't really help me out, but maybe it wasn't the right thing, and or your approach into it wasn't the right setting either, right? So that's what we're trying to say is like, okay, we got to first off, what is your mindset going in? So like the
Hmm.
example Jay said before about the husband coming in, and I've had ones like that for sure, where the husband comes in and it's like right off the bat going, I don't really believe in what you do, but
Or I don't want to be here.
right.
Yeah.
That's like, dude, it's okay. You don't have to be here.
Hmm.
Like, um,
Exactly.
but then once you start explaining things and the interrelationships between things and putting that person at ease and then having them understand like, okay, okay, that's how I got to this.
Hmm.
This is how I'm going to get out of it. And I actually have to play a role in it.
Yeah.
I'm not going to just put all my money on this guy
Yeah.
because
Or just lay there and say, fix me,
Yeah.
exactly.
right?
So that's where you see like there's so many different types of people coming in at different phases, right? Ones that are not conscious of it,
Mm.
one
Yeah.
that are in denial about it. Then the ones that are okay, well now I really, oh man, I've opened the bag and really realized now I really had a huge role in why this is happening. I got to change my whole game plan,
Hmm.
which is unsettling. So then we have to be able to navigate through all those scenarios to be able
Yeah, with
to
every single person every
yeah,
single day, because
yeah,
sometimes they can change between treatments as well, right? How they're feeling and their outlook, they can always can change a bit as well.
yeah.
Yeah, it's fascinating how people can get trapped really early on. Like it's anyway, it's fun to work with, but it's interesting how sometimes people would have pain for like just a week
Mhm.
and have already
Giving
got,
up.
yeah, like
Yeah.
have really said, well, I guess this is it.
Nailed it in.
Yeah, I'm like it's fun though. With the fun part about it is then explaining that and showing them and 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 sharing what they're actually saying, because I find that a lot of people aren't even aware
Hmm.
that they think that way. Like
Exactly.
you said, like they're not even aware how negative their self-talk is, how defeated they sound, how that's kind of spilled into even other aspects of their life, and bringing that up and bringing that to their attention, in a nice way, in an appropriate professional way, how it can drastically change essentially what you feel in your hands immediately to just their whole outlook
Yeah.
to the trajectory of their you know restoration back to normal health, right?
Yeah.
100%.
And we can empathize, some, states of being or some, dysfunctions and or diseases are a lot more complex and complicated than others, right? Um, so yeah, the mindset, the mind, the framing behind what the challenges may lay ahead can be different for everyone, right? So,
It's
um,
it's a very good like what you guys are bringing up is in essence at the root of all that is change, right?
Hmm.
Hmm.
So being a like how are they reacting to having to change or their body changing or all this stuff that's bringing them into a space where they're not comfortable, right?
Hmm.
So you start to see like that wide range of reaction,
Hmm.
like you said, the person that just gives up. Chances are their resiliency is very low,
Yeah.
right? They
Yeah.
have zero
Tired,
capacity.
zero
So,
capacity, zero metabolic reserve, right?
Yep.
and probably
Depleted.
because
They're
that same belief
yeah.
system, like you're saying, is probably in many facets of what they're living, right?
Mm.
100%.
So now we have a good view of like, okay, what's at the bottom of it? Like they're constantly drained.
Mm.
So that
Work
that
drains them,
yeah.
family, everything drains them. Yeah.
Yeah.
Whereas then you got ones that are
They'll
like,
probably use language
correct.
that would allude to that, being empty, feeling
Hmm.
drained, feeling giving up,
Overwhelmed.
overwhelmed, right? Yeah.
But then you have ones that are a little bit more open to that, a little bit more understanding. They start to get it, but then again, even when someone's conscious of it, the aspect of going through the change is so uncomfortable that most people resist it, whether it's at a subconscious level or even consciously sometimes,
Hmm.
right? Like they're just like, ah, no, I tried that, it never works. And it's like, okay, but if you coach them properly, then they start to kind of get almost the ability to allow themselves to get into that uncomfortable
Mm.
space where they have to do something to recover and then slowly get used to it so that the nervous system is able to be there and then it starts to shift into the other direction where they're starting to come out on the other side where they
Hmm.
feel better because they trusted themselves, they allowed themselves to go there, right?
I guess like you say, it's honesty and awareness of where they're at, right?
Mm.
Um,
And sometimes they won't get out of it
mhm.
right away, like so it which is okay too. So you have to almost meet them where they're at
Hmm.
and just let's make sure that the belief system in this particular stage they're at is there to help them out because otherwise they'll it might be too much, you can't force anyone to do anything. Like it
No,
has to be at
true.
their rate and there's zero judgment in that. It's like it is difficult. That's why it's so hard and many people, most of us, reluctantly go there.
Yeah.
Hmm.
Right?
Yeah. Yeah. That's the same as when they, like, is this going to work or how many treatments is this going to take or all this kind of stuff. And it's funny, is this fixable? And, I'm like always, yeah, your body's a map, right? So when you come in, obviously we have to be able to find things that correlate to your symptoms and they make sense that you're feeling this particular way, but by no stretch is there any guarantees, right? Because
Mhm.
I say that like there's a lot of time when you're not here. So what are you doing at home? What are you not doing? What are you avoiding? And then also I'll say like, and do you believe you're going to get better? Like
Mhm.
you have to like
Yep.
you have to have there's a lot of layers for health to come all the way back. So I think it's just you're sprinkling that in, like you said, kind of where they're at and what they can handle at that time. But I think at the base of it all, it's like when we talk about people, we talked about this in one of these previous podcasts about being in your parasympathetic system to be in the optimal state from healing. Well,
Mm.
this plays the same role. If it doesn't matter what you're doing, if there's no belief that this is going to help them,
Mm.
then your results and your outcomes are not going to be where they need to be.
Correct.
So you're much better off taking time away from perhaps treating and discussing and speaking and sharing our experience, right? We've been doing this all for probably 20 years each, and it's you start to see patterns of when things go well. We get a new patient in, and sometimes I can get that feeling like this is going to be hard. This is
Yeah.
not going to have the outcomes right away unless they'll make a switch. And versus others, like you said, Kev, like they're just so open. Like
Yeah.
maybe Sean, that you'd said the same thing. They've already been recommended, referred here. You got
Yeah.
like they feel like they're with the right person. You can get that feeling right when they walk in the door that they're happy to be there and they're ready to
Yeah.
to go. And I think that's what makes work so fun
Yeah.
because you
Absolutely.
can help
Can't
hopefully
cookie
trying to
cut anything.
no.
No, different puzzles, different puzzle pieces, right?
Hmm.
And again, reframing. I think it's Paul Chek. He always says this, the pain teacher, he calls it. So whatever you're experiencing in life, it could be pain, could be dysfunction. It's actually what is it trying to teach you, right? So that oftentimes I'll use that example with clients and patients just to say, okay, you're here for a reason. Let's figure out why and what you're meant to learn from this, right?
Yep.
So it does help change the lens a little bit and
That's a good one.
understand, that they are where they are because of themselves, right? And
Right,
how life
right.
has played out. And
That's the big shift, right? It's
yeah,
going from like the victimization
yes,
belief
yep,
to the, okay, what's life presenting right now?
hmm,
And if I, like you're saying, that's exactly it. It's, am I going to pay attention to this?
yep,
So the signs and symptoms come out when we've had enough of it.
hmm,
So most of the time when people get pain, dysfunction, disease, it's at the end when the body's like, okay, well, I've compensated
For a long
all I
time now.
could compensate.
Hmm.
hmm,
And now, well, I'm going to have to send some alarms. So when you get better at noticing that, then you start noticing them before the alarms come out.
hmm,
And then that can be a huge, but again, it boils down to like what you guys are saying is the person's belief, how they apply that in
yeah.
life, because it's not just at that moment, right? It's like everything they do.
So
How they're living.
what are I mean, we've what are you talk about this often? What are some ways that people can change their limiting beliefs? What are some,
Well, for sure, like what Jay said before, is being conscious of the
Aware.
fact that they're talking like that, right?
Mhm.
yeah,
So it
awareness?
starts with that. You have to do something to become more aware of what you're doing on a regular basis.
Hmm.
So things, meditation can do that, just reflection, journaling can do that. All
Breath
these,
work,
yeah,
breathe with Sandy.
previous and it could
Agree
do
with
it.
Yeah.
Sandy.
So all these things are means to fine tune that ability to be more aware of our surroundings and how we're behaving and everything else too. So
Being more present, less distracted.
that's right. Yeah,
Oftentimes, I think that's it. Carving out, like, encouraging them to find time during the day, every day for them.
Yeah.
And they can pick and choose sometimes what that
yep,
20, 30 minutes can be, but part of that reflection, if you will, of how they're actually living and how their life is going. And if they don't, and you can really peel into, like, how long have you been doing that for?
that's
How
right.
long can you keep doing that?
It's very difficult to do all that type of work when you're constantly stuck in your head, because then it's just a usually constant chaos and mayhem of work, kids, and then wake up the next day, do the same thing all over again, until you take pause and be
Mm.
like, okay, wait a second. What, what's going on here? What is working? What's not? Why do I keep reacting like this? All those things start kind of that process of being able to kind of pinpoint, oh yeah, maybe I need to work a little bit here.
Mm.
What's cool is when people do that and then they say, oh, I started changing it and my pain went away.
Mm.
So then you start making the link between like, oh, okay, how I'm living is dictating how my body is responding.
Mm.
It's a constant mirror.
Yeah.
So that would be part of a huge process right there is the recognition of it, being able to call it out, and say
Yeah.
like, oh yeah, it's true. I do that a
Yes.
lot.
Sit and observe, right?
Yeah.
The internal, external world,
Yep.
how it shapes. I often say that too. It's just, your world is casting and molding
Yeah.
how you show up every day, right? So like everyone understands the idea of a cast, right? To mold, you break your bone.
Yeah.
Well, your environment is doing the exact same thing, internal and external and everything in it, right?
Yep.
And it's happening, as a result of that.
Right. A good depiction of that is like the Hawkins scale of consciousness, right?
Hmm.
So it's going from 0 to 1,000. Zero being you're dead, 20 is shame,
Hmm.
all the anger and all that is 100. Like they're all in these low vibrations, these heavy, dense vibrations
States of being, right?
until you get to courage, which starts flipping on to the more positive side of things, all the way to love and understanding and acceptance and all that stuff. And so when you start to see this, so it's Hawkins scale of consciousness, um, you start to see how people fluctuate in this scale. Like some days when you feel really bad
Hmm.
and maybe you have a bit of anxiety or you have oh, my body's sore and I'm so tired. Look at how you've been thinking and feeling in that particular day or the days prior, and you're going to start to see the vibration you're stuck in.
Hmm.
Whereas when you can shift and move into and find a way to feel a certain other way, you'll change your vibration, right? So that's why the belief part is so key in healing.
Yeah.
It's the belief in something different in terms of the vibration. In essence, really, that's what's
Yeah.
happening.
Yep.
It's the state you end up resonating in, right?
Yeah, exactly.
So if you walk into your office and you're, a sourpuss, right? Yeah, that's
Well,
your vibrational state.
Totally.
Yeah.
it's like showing up to a party and someone walks in and
Yeah.
everyone knows they've been through a rough time and you can literally feel the whole
Feel it.
energy of the room
Feel it.
change.
Yeah.
Exactly.
Or the inverse, right? You walk
Right.
into whatever, a sacred place and you can feel a completely different energy that you're
Yeah.
surrounded by.
Hmm.
Mm.
It's perception.
Yeah.
Yeah. Awesome.
100%.
All right.
So I know you mentioned a book before. What you
Yeah.
want to mention that book again?
Oh, Timeless Healing. That's an
Timeless
amazing
Healing.
one by Herbert Benson. Then there's the Dr. Joe
Oh,
Dispenza.
Dr. Joe
Right.
Dispenza. I was going to say that
You Are the Placebo. I think that one.
that's one of them for sure.
And then
He has a
all of his
great
books,
series.
right? Yeah.
They're very repetitive too in the neuroscience behind
Breaking the
behind them.
Habit of Being Yourself,
Correct.
Becoming Superhuman,
Yeah. Supernatural.
from Supernatural.
Yeah.
Huh?
What
The
was the Hawkins book again? What was the name of that?
Power versus Force.
Power
Yeah.
versus Force.
Power
That's right.
versus Force.
And then there's another one with Lynn McTaggart, The Power of Eight.
Power of
Because
Eight.
you mentioned, I don't know which one you mentioned.
Biology of Belief.
Bear and
Right?
Belief.
Bruce Lipton, Biology of
Biology of Belief. Yeah.
Belief is amazing.
Yeah.
Yeah.
That's a heavy one.
Hmm.
So hopefully this helps you guys out. So make sure, like if you are having issues with something for sure, maybe start to reflect a little bit on how you've been living and how you've been feeling on a regular basis in order to start making those changes into helping you out with whatever you're suffering from. And obviously if you need help on that path, then please let us know. We would love to help you guys out.
Yeah. And also look into your circle, right? Or
Yep.
if you're dealing with something and, ask your friends and family if they have had success with someone helping them through things, right? And because again, the belief, right? Just the knowing that someone, a therapist or whatnot, has been able to help a loved one, man, carries a lot of weight with it. So, but it's
Good
just
point.
get started, right? Get started, see someone, get some help, and the path, as Kev said, ask some good questions and reflect and get on your way. Don't
Awesome.
wait.
All right, everyone. We'll see you guys next week.